I've come to tell you a little bit about nursing in Nigeria that nobody's ever going to tell you about. And I'm not going to sugarcoat anything because the truth is, what you think nursing is in Nigeria and what it actually is are two completely different realities. So in this video, I'm going to break down the good, the bad, and the ugly, and also the part that nobody else talks about. We're going to talk about it in this video. So stay tuned and enjoy. Hi everyone, welcome back to my YouTube channel. If you're new here, it's Nalia and I'm a registered nurse practicing for about 3-4 years now. So everything I'm gonna say in this video is not theory but real life experiences. So if you're an expiring nurse or student nurse or you're already practicing, then this video is definitely for you. Alright, now let's start from the biggest shock. You know, in school, everything is controlled. You have lecturers, you have supervisors, you are taught guidelines, step-by-step procedure. There is this observed structural clinical examination, which is the OSCE, and then you hear stuff like, oh, I'm going to greet my patient, consent for my patient, explain procedures to my patient, I'm going to wash my hand and don your gloves. Those are what they teach you in nursing school. But in real life, there is no guideline. There is no supervisor, there is no checklist. It's just you. You might be the only nurse in the whole entire ward, like in the ward, attending to about 10, 15, 20 patients alone. And in this real world, we're dealing with real patients, real emergencies, and you're not allowed to make any mistakes. You get what I mean? I feel like this is like your first eye-opener into the real world. Like, as a baby nurse stepping into the system properly, you get this big shock. Like, oh my God, what is it? Like, it's crazy. Now, let's even talk about the system itself. The healthcare system in Nigeria is so draining, and I feel like everybody already know about this now because there is a serious shortage of healthcare workers in Nigeria. Everybody is going abroad for better opportunities, greener pastures. So what happened to you all, the nurses who are left behind? Now there are more workload, there are longer hours you need to cover, and more patients to attend to. In school you hear things like 2 patients per one nurse, or 1 nurse to 2 patients, or 1 nurse to 6 patients, depending. In reality, 1 nurse is dealing with 10, 20, 30 patients. And you know what? These people, the employers are expecting you to give your maximum effort. Like, you need to put in your best in everything you do. But guess what? You are paid minimum wage or less than minimum wage. That's the reality for you. And I'm not even joking. You can ask your nurse's friend about what I'm saying. Let me paint a picture for you. You wake up tired from your previous shifts, right? And you need to be at work on time. And when you get to work, as you're stepping into the hospital, you have not even caught your breath yet. Like, you've not even dropped your bag. You just start running up and down. Like, you just get busy because there are multiple patients that you need to attend to, right? Sometimes you don't even get to eat your breakfast or your lunch, and before you know it, you have been standing for almost 8 hours, no break. And don't forget, in the hospital, you being a nurse is not just nurse, right? Come to the hospital, only you nursing, only you technician, only you therapist. You just hear, nurse, my problem, my television is not working. Nurse, can you call the doctor? Nurse, this, I can't find my HMO. No, this, how much is I should pay? I don't have that money. So you have to be the accountant, the solicitor, everything in one. That's not crazy. At the end of the day, while you are still tired from the previous shift, while you have not eaten properly, and while you have not actually sat down to catch your breath, you're not allowed to make any mistakes. Because if you make a mistake, you face the consequences. Because it's life you're dealing with. You need to stay calm and composed. And now it feels like you're sacrificing your body, your mental health, your time, everything for nothing. And then you go back home and you're still thinking about your patient and you're questioning your decision whether you made the right choice by going into nursing or not. And the funny part, while you're at work, right? 1 minute you're admitting somebody, 1 minute you're doing last office for somebody. So it's like your emotions are literally all over the place, and you're not allowed to show your emotions to the patient, right? So after the whole procedure, you go to the toilet, cry for 5-10 minutes, and then you're back again, all smiley with another patient that probably just gave birth to a baby boy. That's the irony. And I feel like the nursing or the healthcare system should make therapy more accessible to nurses, because it's like we have a lot to decompress. Like, for me actually, what I do is I journal a lot. When I know that this thing has sparked journaling, I want that I need to crash out for real, I just open my camera and start to talk. I feel like therapy should be more accessible and affordable for the nurses so that they could literally keep their mental health in check. It's not easy at all. It's not. But then again, I just feel like, mental health is not something that is taken really seriously in Nigeria. But I really hope that people start taking it very serious. Let's talk about something very, very serious. It is so-called auxiliary nurses. So-called auxiliary nurses, aka the quacks. So now, before anything else, let me make it very clear that there is nothing like auxiliary nursing. Either you are a licensed professional nurse or you are not. There is no in between in this thing. But then, because of the shortage of nurses, remember I said that people are literally leaving the country, and because of the weak regulation of the NMCN body, untrained people are really working in the hospitals, wearing scrubs, uniform, and actually treating patients like chicken. You know how dangerous that sounds? I don't feel like people understand the gravity of what this is causing. You know why this is actually so dangerous? Is the fact that it could lead to wrong treatment, wrong diagnosis, wrong everything. And people are going as far as doing home care service, are going as far as treating people on their own. This is what they've seen doctors or nurses doing. And this literally devalues the entire nursing profession, because it's like now they've actually watered down everything we've worked for. Imagine spending millions of naira in school, university, college of nursing, and then you come outside and then you're competing with these untrained people. And then you go to interviews, or yeah, you go to interviews and then you are demanding what you're worth. Like, they're demanding what you're worth. And these people expect you to take bare minimum, because if you don't collect that bare minimum, there's always one of those people that are willing to take way less than what you want. They're willing to take way less and what they're asked of you get. So they feel like, okay, if you're not gonna take that, then you can go. Somebody else is gonna do the work. You get what I mean? And you know, all auxiliary nurses, their excuse like, okay, they cannot afford the money to go train in a proper university or something. Then you're wondering, okay, you don't have money to enroll in, so why can't you go into something else? Go learn a business, go learn a trade, go learn a skill. Because how can you be learning nursing? It's crazy. It's like telling me, okay, I learned handwork on how to become a medical doctor. You learn hard work. If I should ask you about a certain drug, the mode of action, the classification, contraindication, would you be able to answer it? Or the generic name and all that? No. I remember when I first worked after I graduated, the first hospital I worked, I was the only registered nurse there. The first hospital I ever worked in, I was only registered nurse there. And you don't realize how crazy this thing is, because at that time I did not actually know. I didn't know. And then, you know, as a new person now, you know all the things, all the knowledge you learned from nursing school is so fresh in your memory. And now you want to put them into practice, what you've learned. So you trying to do the right thing, the right procedure, and then all of that. And everybody else is just doing something else. Like they've already normalized the wrong thing and all of that. So you now, you're not trying to be different and all of that. And then they're like, what's this girl doing? Does she know what she's doing? All those kind of things. And you know what's crazy? You are told to manage, right? Because I remember then, when I was looking at the reception, you know, checking vital signs, all of that, I will always wear gloves, right, while checking vital signs. Because at this point, I'm coming in contact with patients body fluid, sweat, and all of that. And I always wear gloves to do vital signs, BP, temperature, all of those. And then somebody literally sanctioned me and said, you are wasting the gloves. You are not supposed to use the gloves for this procedure. Yeah, that's what they said to me. That I'm wasting that. We're supposed to manage gloves. We actually supposed to manage gloves. You be on duty, 9 duty, and they already counted the numbers of gloves they're supposed to use. They can count about 10, 15 pairs of gloves for you, and then they hide the remaining one deep down inside the store, right? So when you don't manage those gloves and it finishes, probably some people get to use their hands to do the work. But me, what I do, I enter the store, I search, like where they used to hide the gloves, inside, down. Then they will not claim that they don't have any gloves, that that's the only one they have. I will go there, find the gloves, and bring it out and use. When the next morning comes, you want to be like, oh, who went to come collect my gloves? Who went to come collect? I'm like, I thought people say you don't have gloves, then I'm not sure. I think there is a mix up somewhere. For sure, I thought it caused a little bit of commotion and then it will end. So yeah, every year the hospital needs to get accreditation and update their credentials in the hospital, right? And this usually requires them to get a nursing certificate and license to show that yes, they work with registered nurses, right? At this point where I was the only registered nurse in that hospital, it was my license and this thing they used, but I was not aware that that was what they were using it for. Get So if you're not listening to me, make sure you guard your license with your heart. Guard it very well. Because even after you leave that hospital, they will still keep on using it, your name and your credential to cover their hospital so they don't get it closed down. So if you leave a hospital, make sure that you inform a certain body or organization that you have left the hospital. You get, so they cannot keep using your name. Moving on, it is no news that nurses are underappreciated, undervalued, and disregarded so much in this country, right? And there's this very bad stereotype that nurses have. Nurses are known to be rude, they are known to be this, they are known to be that. And some people go as far as saying, I'll try disrespectful stuff. Probably they say something like nurses use rarely sleep around, and nurses used to sleep around a lot. So whenever you tell somebody you're a nurse, automatically their mind is going to, oh, you're you, you're people already treat nurses terribly. You get, like, we are expected to just swallow the disrespect, swallow everything, and just take it all in. And if you're not a strong person mentally, or you don't have thick skin, this will literally change how you view yourself as a person, because it's a stereotype that cannot even break at this point. It's already in their head, like they already want to think about it that way, so there's nothing you can do about it. Yeah. But if you think nurses are rude, then good for you. Now, can we talk about equipment for a little bit? Do you know that 95% of the equipment that we were shown or taught in nursing school or universities, hospitals do not have them? Let's even think of something as low as tourniquets. So you know that some people have not actually made use of the original tourniquet. Most hospitals make use of gloves as tourniquets. Some make use of the classical drip set part, literally cut strip sets, tie, and that literally tourniquet. Still, if I should bring the real tourniquet to you now and give it to you to use this and draw blood, would you believe that a lot of people might not really know how to use it? Because why? It is not always available. The proper equipment are not. We always improvise and we always try to manage, because they cannot provide the necessities for us. Aside the part that we have to manage, there is the financial and the ethical part of this profession as well. You all know that in news that in Nigeria, there are some hospitals that literally reject patients. Like, you hear people's story of how they sent their relatives to this particular hospital, and then they were rejected by 5 hospitals before they finally took them. And by that time, it's already late, and then everybody's gone. One of the major reasons why people reject patients, aside the fact that some hospitals might not be equipped to treat a particular illness, some hospitals are trying to prevent having that death records in their system. And then secondly, some hospitals, right, no matter how much you are dying, no matter how critical your case is, they will not treat you unless you pay deposit money. Yes. And let me tell you something, right? If you as a nurse now say, you know what, go ahead with the treatment, they're going to pay, and that patient did not pay for that treatment, you are going to take responsibility. You as the nurse are going to take responsibility for that patient. I mean, if you decide that you want to be Onyoma or you want to do Onyoma, that's a good person, and treat somebody without collecting upfront, even an like critical emergency, right? And this person did not pay that bills from your salary will suffer. No go chop for 1 month. So imagine somebody that's already earning minimum wage, right? And now you decide, you have the passion, you want to save a life, right? So because of that, you now treated the patient without collecting any deposit, which is insane to me actually, because I'm supposed to save a life. That's a normal thing to do. But he did not do that. And now these patients have left, right? And out of that 70K or 45K or 150K they're paying you, the bill is now like 500K or so. So that means for almost half a year, you are paying the debt of somebody else. Wow, because you decided to save a life. Is that not crazy? Yeah, so whether you decide to be the Onyoma and save a life, or you decide to protect yourself, it's left to you. Okay, it's left to you. So, but most times I feel like we should follow hospital policies. But if you do not mind having to sacrifice your for a life, which I feel like is a good thing to do, it's up to you. It's up to you. Up to you. I can't tell you what to do. But if it's me, I'll choose to save your life too. Because that's what I've called to do. The calling, be a card to have humanity. So I don't know if you ever find yourself in that kind of difficult situation. I hope you choose wisely. You guys, I've left beside nursing, right? A lot of you know I've diverted to another branch of nursing, right? And now the reason why I actually left bedside nursing is because I could not handle it. Yes, I could not handle it at all. You can call me what you want, but I could not just handle it. The stress, the lack of structure, the pressure. It wasn't worth it. You could know that time is expensive and precious, right? There is a way that you'll be undervalued and it should just make sense. But then if you get disrespected by the patients, the relatives and everything, the HR and the hospital himself, they now disregard you on top. So it's like nobody actually appreciates my work. You get what I'm saying? Yeah, it wasn't worth it for me actually. And I feel like when the employers know that these employees, that the nurses, have the free will to actually leave their work, they will do better. But then I feel like people in Nigeria are taking advantage of the fact that the economy is not good, so people cannot really literally quit their job just like that, knowing that they might not get a job anywhere. So they stay stuck there for 10 years, 15 years, 20 years, and guess what? Their salary never increase. Even if it does, it's like a pinch, just a pinch. You get? And these employers, they know what they do because there are some months where they'll be like, okay, this is cost of living. They just send like 7.75 or 15K for cost of living. And they will not make it so clear that this is not part of the salary, but it's becoming in and out, you know. And I'm telling you that you will see matrons that have served the hospital for 10, 15 years, but then they cannot even afford to buy Camry, Toyota Camry. They cannot afford to buy that little car. That's how draining. Like nothing will literally drain you. It will drain you, and you have nothing to show for it. You have nothing to show for it. Yes, like if you're not strategic with this, your nursing thing. Because guess what? Passion is not gonna pay your bills. Passion will not pay your bills, baby. If you know that this bedside nursing is draining for you, you should literally quit. Choose yourself always because if anything happens to you, they're gonna find a replacement immediately. And the cycle continues. Now I know I've said a lot of things about nursing, you know, but there is a good side here. There's the good side. And you know the good side. You know that point where you literally suffer to care for this patient 3 days, 5 days in, and this patient gets well. And they genuinely thank you for taking care of them. Patient that came in with a stretcher, walking back home, that is really rewarding. I'm not gonna lie. And then the patient is like, oh my God, God bless you, thank you, it's gonna be well with you. That is the good side of nursing, again. And nursing, nothing is going to build you. Nothing is going to build you. It's going to give you resilience. It's going to give you a bit of skill that you won't find anywhere in the real world and you take anywhere with you. I'm talking communication skill. I'm talking interpersonal relationship, how you relate with people. Because you know that there are 80 billion people in this world, right? And not everybody is sane. And most of the time, 75% of the time, you are dealing with the insane ones in the hospital, right? So you need to have your patient's level is going to be like 1000%. You need to exercise patience because now in the midst of disrespect and all of that, you need to stay calm. You need to swallow it because everybody makes these excuses of, you know, they are sick, so you know they're already frustrated enough, so they just need someone to just pour the frustration on. So it's like now they are now acting irrational or being disrespectful, and I feel like it's just a lame excuse because for you being sick doesn't mean you should be disrespectful. You can be going through a lot and still decide to be kind to somebody. But you know, everybody is just brainwashed at this point. But yeah, I know that some people genuinely are going through a lot, but still, kindness is still the answer no matter what, okay? Again, let me be very honest with you. Passion will not pay your bill for the people who are aspiring to become nurses. Hmm? Passion, having a passion. Somebody will ask you, why do you want to become a nurse? You're like, oh my God, I have passion for it. It's a calling. It's something I want to do because, you know, I love treating people. That's good. That's good. But if you really want to go into this profession or this line of career, I feel like it should be very, very strategic, not emotional. You need to be very strategic. You need to think, you need to look at the bigger picture. And if it's something that is worth your time, then you should go into it. And I'm thinking about multiple streams of income because nothing alone in this kind of Nigerian system will not pay your bill. You need to think far. If it's passion, so you can be nursing for passion and then you have other income that you are earning well from. Think about your long-term plan. Then for those who want to travel abroad, you think about your relocation plan really well because if you do not have a strong support system and if you do not have like something else you're doing to back it up, I don't think you can really relocate this country realistically. Tell me why somebody will be earning 70K a month or let's say 150 or whatever amount it is. From that money, you take transportation to work every day. You feed from that money, you pay house rent and all of this. And still, you're so expected to save for your abroad examination. I'm talking IELTS, I'm talking, and now the cost of IELTS examination is like 290 something, almost 300k. Now imagine that you say you want to use 8 months to save 300k to write that examination, right? When that 8 month come and your money is now complete and you want to really pay, you now realize that okay, they've increased the money again by another 100k. So now you have to really keep that money and save for that 100k. You see that it's not realistic, right? And then every day people will be like, what are you still doing here? You're a nurse. Nurses are making it abroad, this kind of thing. So what are you doing in Nigeria? Are you going to sponsor the bill? Sarah, Ma, are you going to sponsor the bill? So shut the fuck up, okay? You need to be very strategic. But if you know that your passion can carry all after, thinking far and wild, then you can go into it. It's a good profession. I'm not gonna lie, it's a good profession. I'm a nurse, so I'm telling you, it's a good profession. In the light of Nurses Week, this is a huge shout out to all the nurses out there who are holding it down together in the hospital and everywhere else. We see you, we see your strength, and we do not take it for granted. In as much as we are unappreciated, we the nurses ourselves, we really appreciate you. We appreciate your efforts. We appreciate everything you are doing for us in Nigeria, because I feel like nurses are the backbone of the hospital. In as much as everybody says a lot of things, I don't think a hospital can do without a nurse. I don't think so. It's not possible. So yeah, we see you, and I know there is nothing happy about the Nurses Week, but yeah, we should still find every reason to be happy and joyful, right? If you feel like bedside nursing is something that is already draining you or it's not for you, there are other pathways of nursing that are actually doing better. There is the corporate nursing, occupational health nursing, home care nursing. You can look into other pathways. It's not only bedside nursing. The world has evolved. There is even telemed. A lot of things you can do, not just bedside nursing. So I think people should have more awareness on things other than bedside nursing. And then if you feel like you've explored other parts of nursing and you feel like, okay, this nursing is not for me, then you can change your direction. It's not so late to start again. Change your direction, learn a high income skill, dive into something else, and I feel like you keep prosper there too. So I hope that with this few points of mine, I've been able to bring clarity and understanding to a little part of the nursing profession. So if you've seen this video up to this point and you feel like it's something you really want to pursue, that's good for you. So if you're an aspiring nurse, make sure you think about it. If you're in school, make sure you can still rethink about it, okay? Because we are spending millions in school and then we come outside and we earning peanuts. That doesn't even make sense to me. Think about all these things. I feel like you come to the right decision. But nursing is still a good profession regardless. That's a little bit about nursing in Nigeria. If you found this relatable, if you found this helpful, do not forget to like the video, drop a comment, share this video to your peers and your family members, and give the video a thumbs up, okay? And I'll see you in my next video. Bye!